Hello and welcome to session 5 on leader in adult care. So we're now looking at unit 4. I believe that's governance. So let's kind of dive into this. Needless to say, a bit of what we covered last week is going to link into this around resources, planning, policies. So let's just have a look to see how this kind of all links together. It's important to say that governance can take shape in many different shapes and sizes. It really is down to your own organisation's policies and procedures on what you audit, how you audit, and the frequency. Now, it's also important to say that there are other systems out there where you can buy systems in, or again, you can look at audit tools. There's no right or wrong here. If you buy tools in, can I just strongly recommend that you quality assure them and you understand what they're for. Let me just pop that on. So you understand what they're for and you localize them for your service. So they're specific for what your organization is and does. So let's have a look at this unit and we can run through the assignments as well. So LMAC 2A, governance in adult care. So we're going to look at the legislation, we'll summarise that legislation, we'll analyse some of that impact, we'll explain the roles, and then we'll look at the assignment for that. So again, looking at the assignment there, actually I think that assignment wasn't in the right place, so we'll pop that back. We'll look at the assignment and then we've got the example essay. Then we're going to go to understanding models of delivery. Again, another small essay, and then we'll look at internal governance and evaluating our systems and methodology. And again, a small assignment. So there's 3 assignments for this. So both quite small. I think they're about 500 words each. So we'll dig straight into this. So understanding legislation and guidelines then, within your professional discussion, within your assignments, within your endpoint assessment, you must be able to kind of cover these as a minimum kind of standard, really. So the Care Act 2014, it's essential that you understand what the Care Act is, how it relates to people's rights, well-being, choices. The Mental Capacity Act 2005, it was amended in 2019. With the LPS attached to it, so the Liberty Protection and Safeguards. So just be mindful that that one has been updated and amended. The Human Rights Act, so again, we have our own version of that, so just make sure you look at the amended ones there, and then the Equality Act. And then we have statutory governance around care and support, DOLS, safeguarding, and then now the single inspection framework. So summarising those legislations then, so the Care Act it's an established framework for adult care in England. It emphasises personal well-being, prevention and collaboration with local authorities that covers assessments, eligibility criteria, care planning or person-centred care planning and safeguarding procedures. The Mental Capacity Act 2019, LPS, again, the revised version sets out in the laws what a person is who lacks capacity, and it looks at the threshold for liberty protection safeguards for depriving people. So again, your LPS may or may not be in where you are in the country. Some councils have already started to roll with this because it came into force in 2019. Some haven't because they've delayed it because of CQC monitoring. The Human Rights Act obviously sets out the rights. So the right to life, the right freedom of torture, the right to respect private and family life is protected. But equally, what we must really understand there is the fundamental principle that works in tolerance on all sides. So nobody has any more right than another to deprive anybody of their liberty or their rights. And therefore, when we end up in these ethical debates around religion, sexuality, religion has a right to be protected, so does the LGBT, but we should all respect the basics of human rights, which is the right to a private life, the right to privacy. the right to life, the right to live. Ultimately, when we end up with those conflicts, we need to be looking at those arguments and looking at, are we breaking any human rights laws in the process? And then the Equality Act 2010, obviously looking at those areas of discrimination or indirect discrimination, such as age, gender, disability, etc. Then we've got our statutory frameworks, including the new single spectrum framework. Again, if you're part of the United Care Network, you'll be able to access those audit tools. So when you log in, go to quality, and you'll be able to see all of those audit tools there. Great. Looking at 1.2, analyse the impact of legislation and policies and outcome-based social and person-centred practices. So we look at care philosophy approaches. So this is where legislation such as the Care Act and the Mental Capacity Act 2019 shapes the philosophy of care, because ultimately we've got this emphasis on autonomy and the right to choose and empowering people. But on the other hand, we've got a duty to safeguard from self-neglect, safeguard from abuse, and sometimes they can conflict. Equally, we need to think about our outcome-based and personal-centered approaches. So how we manage our outcome-based approaches, whether we're using the STAR model, a recovery model, or a personal-centered care planning approach model. Guidance and regulations. So again, statutory guidance looks at care and support statutory guidance, and then DOLS or the LPFs. And they look at kind of outcomes in making interests or best interests for people. And you need to have your policies and procedures up to date to make sure they're reflecting that. And again, looking at your service, making sure that your policies and procedures have met the equality and diversity principles. Again, if you're new to writing policies and procedures, I strongly recommend you look at NHS policies and procedures, because on the back of their policies, they have an equality impact assessment, which basically means they can prove in law that their policies and procedures do not directly or indirectly discriminate any of the protected characteristics. And if they do indirectly discriminate a protected characteristics, there's justifications why. And what can be done to level that playing field. So if you've never seen an NHS policy, just go online, Google an NHS policy, and look for that equality impact on the back of their documents. And if you're going to use frameworks and models for governance, so if you're going to use ISO principles like ISO 9001 for quality assurance, it's useful to look at some of these. And again, we'll look at some of these reports where I can just give you an idea and a flavour of what some of that looks like. Impact and outcome-based approaches. So a shift from results, a shift from task-orientated care, if you will, under the Care Act 2014, moving it to an outcome-focused, looking at empowering people and promoting independence. And then finally, the impact and personal-centred approaches looks at the Mental Capacity Act 2019 revised LPS. And again, that's looking at the autonomy, the right to choose, and the right to make unwise decisions. Equally, we need to think about our risk-taking, so positive risk-taking, negative risk-taking, and that balanced score sheet. You might have a risk panel that looks at risk and weighs it up and makes a final decision. But ultimately, we need to have that framework and that way of working to show the processes and the due processes we've been through to make those assessments and assumptions. And again, looking at informed decision making and understanding what informed consent and choice is. And again, those should be very clear in your policies and procedures. 1.3, which is explain your own roles, accountabilities and responsibilities and implementing legislation, looks at kind of your duty of care. So your duty of care under the Care Act. And this is really important, because if you fail to provide a safe service, that is what you will get a notification from CQC under. So if they look to prosecute you, it's normally under the fact that you fail to provide a safe service. And it's normally if you fail to provide a safe service for one individual, you fail to provide a safe service for all. So just be mindful that CQC are taking small outcomes and making them big. Also, I don't know whether it was last week, we talked about the CQC single inspection framework and their regime. And I highly recommended you looked at that solicitor's podcast. So I'm hoping you've had a chance to look at that. So again, thinking about your roles and responsibilities in line with this legislation and statutory framework, it's really important you understand your roles as a registered manager, and if you are a responsible individual as well, so the nominated individual as well, that. Now, ideally, you should never be the two, and if you are the registered manager and the nominated individual, responsible individual, you want to separate that as quickly as you can, because you want to be able to pass on some of these concerns onto somebody else, to be able to think and reflect upon decisions that are being made. So you're not holding all accountability. So thinking about your accountability as a registered manager, it is your primary responsibility to have governance and oversight of every single service user using your service. And what CQC will ask you is, how do you have that governance? How do you have that oversight? How are you ensuring that all your staff are trained, up to date, that policies and procedures are read and understood and up to date, that safe ways of working are done and understood and up to date, that people's care is assessed and reviewed regularly and up to date? And therefore, the only way you can answer that is with good governance. So making sure that you have clear lines of accountability, clear lines of authority, and if you have departments that they feed into you, and that you can demonstrate this through quality assurance, so through your audit process, through meetings, and ideally you will have internal governance, so that's your own audits, and you will also appoint an external governance. And organisations that normally hire external governance as well tend to do a little bit better in inspections because they have a new set of eyes looking at everything. So please make sure that you think about external governance and how you can have an independent person coming in. Now, ultimately, if you're in a situation where you've got a home down the road, you could govern each other externally, because it's just this extra pair of eyes over your service, making sure that you're being questioned. And this isn't to catch you out as a registered manager. This isn't to catch you out as a leader. However, in our mind, where we're so busy, we're dealing with lots of things, we can have oversight. And oversight causes risk. Risk causes uncertainty. Uncertainty means that the service isn't safe, and therefore you're likely to end up with a prosecution. You can avoid all of that with somebody challenging you. And it's good to be challenged as a registered manager. So, Steve, you said that, why? You wrote that, why? In that policy, you said this, why? Steve, can you show me the last set of policies you updated? Can you show me the last set of audits you did? Okay, in that audit, can I now follow that audit? And what the external person should be able to do is they should be able to pick up your policies, they should be able to follow what staff do, and they should be able to pick up your audit tools, and they should be able to audit in exactly the same way you did. Equally, it is your responsibility around people's understanding. So making sure that people understand the Care Act, making sure that people understand DOLS and LPS, making sure that people understand Health and Safety at Work Act and COSH and equality, making sure that training development is up to date. So not only the mandatory training, but any specialist training that you need as well to meet individual needs. Remember, there's a little clause in CQC that says you have a responsibility to make sure that you are able to look after the staff, to look after the residents or the service users in which you offer the service to. Now, what that might mean is you have a diabetic patient, and let's say you're responsible for that patient who's diabetic. You normally have the nursing team come in if you're residential. But what happens if they can't get in? You still have a duty of care over that individual. You can't just simply say, oh, it's not my fault, I was waiting for the community nurses to come in. So you have a duty of care to make sure that you have the right training and that you have the right protocols and you know how to deal with that patient in an emergency situation. Equally around assessment and planning, if you assess an individual, it is your responsibility to plan the care for that individual. So make sure that you understand what you're accountable for and your roles and responsibilities in line with your registration when you become a CQC registered manager. So looking at outcome one, you've got a 500-word assignment here. You're looking to cover or summarize current legislations. You need to analyze the impact of the legislations and policies, and you need to explain your roles and responsibilities. And again, here, you've kind of got a sample of what that looks like. And there's your example essay as we always follow them up. So learning outcome 2 looks at and understanding models of service delivery within adult social care. And these models of delivery are well established. They all have positives and negatives of all of them. So again, if we look at the medical model, this is very much a formal doctor diagnosis. We know best, you do. We're here to diagnose treatment and disease medical conditions. We have the social model, where it's the emphasis on participation, looking at promoting health and well-being. We then got that personal centre model, which is pretty much the model at the middle of every decision. The home-based care model, I've seen the home-based care model work really well. But again, that's the model prioritising and providing care and support for individuals in their own home environments. It's like domiciliary. We want to avoid any kind of title that says institutional, but those models more look at the nursing models. Managed care models looks at kind of that social care, supported living, community-based models, people living in their own homes out of the community, and then the holistic model, kind of recognising all areas. So let's explain some of the functions of those models. So if we look at the medical model, it's used in the primary medical care and it's used to diagnose, treat medical conditions and diseases effectively. The medical model looks at diagnosing, so making a diagnosis, coming up with a treatment plan, monitoring those treatments, and then managing the disease. So the medical model very much is primary healthcare, and it's not something we would expect to happen in a nursing or residential home unless you had advanced clinical practitioners that were able to assess, treat, and diagnose under the medical model. The social care model then looks at that community engagement, the advocacy and education, and then personal centre care, kind of putting the person at the centre of their needs. And I won't go through the rest, but you can have ready those. So again, you don't have to explain all of these in your assignment. Just pick one or two, do a comparison. So you can say, look, we use the personal centre model, aligned probably with the social model in some aspects. These are the positives and negatives of those, and that's how you would do an evaluation and analysis. So when we look at explaining management and governance across those models, they obviously do look different per service. So primary healthcare looks very different to secondary healthcare, and that looks very different to social care. So even though we're all governed by CQC under the new single inspection framework, it's governed in a very different way. So the NHS has massive governance, where yours is going to be probably you. But anyway, we can look at some of those functions. So management functions is around leadership. So good governance is followed by strong leadership. So a leader is somebody that's able to be inspiring, lead from the front, have vision for the organisation and carry that organisation forward. Where a manager is somebody that normally oversees the day-to-day running, and a manager is more about meeting targets, where a leader is somebody who's a bit more inspiring. Resource allocation, obviously for governance, one of the things that you will be measured against is, do you have the right staff, the right staffing levels? In our audit tools, we've got some calculators and things there to show you. But again, equipment, etc. Staffing, so that's from recruitment to safe recruitment through to training, supervision, and making sure that staff are fit for purpose. Your quality assurance and making sure that you're conducting high quality assurance, and then information systems, so you're able to track documents and obviously report. So that's your management functions. Now, as I've said, if you're a member of the United Care Network, that's what our website pretty much does. We've given you access to recruitment, retention and training. We've given you access to supervision tools. We've given you access to our quality assurance systems, so our ISO 9001, 14001, 18001. So it's quality, health and safety, environmental impact. We've given you access to all of our quality assurance tools, and then our information systems that brings it all together. Then we move into governance functions. So a governance department, so your quality improvement leader, primary role is policy development. So from the above, what works, what doesn't work. And if it works well, why does it work well? Let's put that into a policy and a procedure. And if it doesn't work, why doesn't it work? Review the policy and procedure and come up with better ways of working. And those policies and procedures need to be on an annual quality improvement plan to make sure that they're being reviewed on a regular basis. Regulation and compliance, so your governance is responsible for meeting national guidelines, so that might be your NHS, that might be your local authority, and that might be CQC. They're going to have quality oversight, so they're going to conduct the audits, they're going to look at the data, they're going to analyse the data, and they're going to interpret the data. They're going to be responsible for stakeholder engagement, so that's surveys from staff, from your stakeholders, that's staff, family members, service users, suppliers, and local authorities. They collect all that data, they'll be able to do qualitative and quantitative research on that, they'll be able to come up with a QIP, quality improvement plan, and from that they should be able to develop your SAR, your self-assessment report. Financial oversight, so governance is about making sure that you're sustainable. If you're not sustainable, then what's the point? At the end of the day, you're a business. You have to make sure that you've got financial oversight. And that's transparent. Ethical decision making, so following those 8 principles of good ethics and those 3 theories, such as the virtuous theory there. Risk management, so looking at positive risk taking or looking at negative risk taking and seeing about, does the organisation go forward or not forward with certain things. And then governance should be able to advocate for people as well. So when we think about the model and what governance does, they pretty much are the main function of keeping your service safe and well led. Good governance, strong governance, will keep you out of any line of fire with CQC. And the problem that we have in most care services, they have a care manager, a deputy manager, but they don't have a governance person. And if you haven't got governance, you are going to struggle, because there is so much more of an emphasis now on what you do and why you do it. 2.3 explores innovation, so looking at new ways of working, so whether that's technology, so that's things such as your EMR charts, your electronic care plans, your electronic booking in and out, online learning, VLE, vital signs via innovation. So lots of technology there. And as technology progresses and moves forward, there's going to be a higher expectation that we take on more responsibility, because technology will be carrying some of that weight. So it's really important, if your digital skills aren't right, go to my Google channel, look at my digital skills section. I put a video up there each week about different digital initiatives, and it's worthwhile having a look at that. Personal centre care planning, so again, thinking about innovation there, looking at shared decisions. A lot of care plans now do call this care circle, so family members can contribute, doctors and all that lot, so everyone can contribute to those care records. Data analysis, so using intelligence to look at trends, look at data, analyze that data. Telehealthcare, so things like your full bells and etc. And then community engagement platforms, so looking at online platforms to facilitate community engagement. And that's kind of what we did through COVID, right? So that's going to be things like using your WhatsApp for communication to widening that piece of work. So thinking about alignment across the modules, the care continuity looks at kind of the way that the care plans and information is shared, how we share that information. So for example, what happens if someone becomes unwell? Does your software allow you to print out a hospital pack to give over to the hospital quickly? Standardized protocols. So this is really important. So standardized protocols are guidelines of care that apply across all modules. So your standardized protocols are going to be things such as your falls. If somebody has a fall, there should be a standardized protocol across the board. Standardized protocols for missed medication, for medication errors, plus or minus. Standard protocols for diabetes. Standard protocols for wound care. And it's standard practice, so it doesn't allow for confusion. You've just got a standard way of working, which is then tied into your governance, that's tied into person-centered care plans, but there must be a minimum set of principles applied. Interdisciplinary collaboration, so you need to show that you are working with a wide range of experts, because it's obviously those experts that help with the co-production. And again, where we're moving into much more complex care, we've got to make sure that we've got the right skills and expertise. So, for example, if you've got somebody having regular falls, have you done referrals to the OT? Have you done referrals to physio? Have you done referrals to the falls team? Have you done a referral for a medication review? If they're diabetic or have an underlying health condition, is that all being monitored? And everybody has a shared responsibility for that individual. And it's your responsibility as the manager to bring that all together and to coordinate that care. Again, policy alignment. So that's obviously making sure that they're read and understood, that they're redistributed, and that people understand them. And here's a true story. I was involved in a coroner's case where a member of staff accidentally killed a service user. She drowned her in her food. And basically part of the evidence that was presented to the coroner's court was the fact this member of staff had signed all the policies and procedures, and therefore she knew what she was doing was fundamentally wrong. What the judge turned around and said was, are you saying to me that this person on this day read 100 policies and understood them all? And the answer is no. And he said, but it was your responsibility as the registered manager, not for me. I was investigating. He said it was your responsibility as the manager to make sure that your staff read them and understood them. How did you test it? What is it you're doing? Do you do that standardized protocol? Are you testing them out on a regular basis? Do you run drills? Do you, so all of these questions came out of this. So policies aren't just, we've got a set of policies, they're sat on a shelf, but they are a live working document. And when CQC come in and audit you, they are going to audit you against your own policies. So if you are not working in the ways of your own policies, you are not safe, you are not effective, and you are not well led. It will be as simple as that. Education and training, obviously same thing. It's your responsibility. So this member of staff, going back to that coroner's case, she had her MVQ3. She was also the trained first aider. The member of staff apparently froze, and the judge said, had you ever tested them? Had you ever done a drill? Have you ever tested those competencies, or were you just trusting the certificate? Obviously, the manager said she was just trusting the certificate. That dug her a hole, because obviously she failed in her duty of care to test the member of staff. And as he said, just because they got the certificate does not mean they are consciously competent. It just meant they were competent at the time that the certificate was issued. So therefore, she had failed in her duty of care to provide good education and training. So you can see how quickly it turns back to the registered manager's duty of care. Continual quality improvement. If you're on a quality improvement program, you would be able to have team meetings, you'd be able to show SARS, and part of your internal quality improvement is policies and procedures and that reviewing of them. So my recommendation would be each month, bring out a couple of new policies, update them, give them back to the staff and let them be part of team meetings, get people to talk about them, get them to review them, get them to discuss them and record that those discussions took place. That's going to be far more valid than just a signature to say that they've read and understood them. Okay, and then obviously to make sure that you've got the right resources, etc. Good. So looking at learning outcome 2's essay, you've got those 3 learning outcomes to achieve. You have to explore models of service delivery as what's on there. You need to explain what management and governance across the models look like, and you need to think about how innovation works across the models. So again, roughly 500 words, and you'll work your way through that. And I've obviously given you a bit more bump on there. And there's your example essays there. So you don't have to do lots, you're just going to pick a handful. Again, a nice beginning. Each header so it's very clear, so we can see the learning outcomes have been met, and then a conclusion, bringing that together. Right, so learning outcome 3, so understanding internal governance in line with your own organisation. So first of all, we need to understand your organisation structure when it comes to governance. Who is the final decision maker? And that's really crucial when it comes to investigations, because if CQC comes out and they're not happy with something, they need to know straight away who is in the organisation and who is responsible for shared decision making, and therefore your organisational structure will do that. So if you are a registered manager and you do not hold the authority, so in other words, you're not the one signing things off, you haven't got the final say on anything, you need to make that very clear within your organisation structure. So if your role as the registered manager is very much the day-to-day operation and not responsible for hierarchy decisions, etc., so referring to policy, procedures and structure of the organisation, you need to make that very clear in your organisational structure. So please make sure you do that. Really important when CQC comes in, so they know who has full responsibility. And the reason we had the 2-tier approach with CQC, so the registered manager and the nominated individual, responsible person, was around the fact that there was this person they could go to if they needed to. Equally, looking at missions, values, and visions, making sure that you understand them, making sure that the staff understand them, because when CQC come in, they want to understand them. They want to understand why you're doing what you're doing. And if it's in your missions, visions, and values, it's clear. But part of that, it should be understood through the behaviour. So if I came into your service, I should be able to, just by observing what's going on, have a stab at what your visions and values are, because we should be seeing them through staff behaviour. They should be in the statement of purpose. They should be in the service users guide. There should be a nice fluffy poster somewhere with them on, a nice poster in the staff room. And what tends to happen in the NHS, a couple of days before CQC come out, we all get ID cards with the visions and values on the back. And I remember when I was working for Oxley's NHS Trust, it was something like, we treat people fairly, we value people, because I remember it being on the back of the card, my ID card. So yeah, just think about those, think about how you're embedding those into your policies and procedures. If you have a board of directors, that should be understood in the organisation chart, because again, is it the fact that policies and procedures are produced at a local level? Are they then signed off at senior? And then is it the board of directors that have the final say? Equally, with the audit reports, who do they go to? So does the board of directors have overall governance? So who has final oversight of the organisation? Because it's the person that has the final oversight of all organisations is the one that really should understand internal governance. Governance policy and procedures. So there should be a clear set of policies and procedures for governance, again, around decision-making process. So looking at your leadership styles, looking at how things are influenced and changed. Is it through transformational leadership? Is it transactional leadership? Or is it a hierarchy of decision-making, or who has the power and the authority for decision-making? Again, financial oversight. I've worked in a lot of organizations where I don't get to see financial oversight as the register manager. I tend to get a baseline of the figures and I get told what I can and cannot spend. So that was somebody else's role because that was quite a full-time role. Compliance legal framework. So thinking about your compliance, so thinking about your employment, your regulation, your HR, who deals with that? Again, that should be on the organizational structure. Risk management, so looking at who manages risk. Your policies and your procedures are a risk, just throwing that out there. But equally, whoever manages the risk within the organization is responsible for your business continuity plans, your crisis response plans, making sure that you have the adequate insurance, making sure that you mitigate risk through training. So they should be involved in some of the business planning as well. There's ethical considerations. So again, we talk about ethics around, doing no harm in the best interest of full autonomy. But how was that translated into our missions, values, and visions? Stakeholder engagement. So looking at who has oversight, who is responsible, how do we get their feedback, how is that collated? Communication and transparency. So again, what information is being shared? What does your communication policy say? How is that translated across the organization? Your training and development. So who's responsible? So who's your learning and skills mentor? What's their background? How are they trained? How are they monitored? Who's supporting them? And then your continual quality improvement cycles. So that's your self-assessment report and your SAR. So a massive amount of understanding around governance there. Evaluating the internal governance for your own organization then. So a review of your governance documents, so that's your policy procedures, who does that and when does that happen? Understanding decision-making processes, testing some of that, looking at those minutes of meetings, making sure things are followed through. And compliance, looking at laws and regulations, so spot checking that that's all happening internally. You'll be surprised how many homes I go into. They've got either an out-of-date health and safety poster up. I mean, you're talking about the brown ones that went out about 20 years ago, so that's impressive. Very, very frequently, I see insurance certificates are out of date on people's walls. The ICO, the information commissioners, I don't see who the data person is there, so nobody can ever answer that when I ask them. Things such as who are your health and safety reps? Very rarely staff can answer that. So we're talking about basic legal compliance stuff. If I walk into a shift as an assessor, as an inspector, I would expect the staff to be able to say to me, "Hi, Steve. Yeah, Margaret's our first aider. Bob's our fire warden today. Sarah, she's doing medication. She'll be wearing anything that says do not disturb." And everybody knows who or what's going to happen. So again, it's really important that each shift has a leader for clinical decision making. And that's for simple things like, let's say somebody's had a fall. Somebody has to make the final decision what's going to happen with that person. Again, looking around transparency, analysing training and development, what's working, what's not working, has it changed behaviour, has it not changed behaviour, how many people have done it, gathering feedback, and obviously create that improvement plan. So you get the idea. Evaluating your internal governance all comes down to your internal quality assurance processes. So have you got a governance plan for the year? Do you know who's doing what? Do you have a governance meeting that kind of plots all of that in? If you don't, then that's something you're going to need to consider to do. Explain your own role in applying and leading and evaluating this. So as the register manager or the manager, you're looking at how you're going to apply that, how you're going to contribute, how you're going to manage them, and how you're going to support your team leaders in the day-to-day overall running of the service. When you lead the governance procedures, how you can manage your team leaders, your managers, how will they understand their roles and responsibilities around governance, so policies, procedures, audits, and coming back to departments of heads and directors. So again, they all play a part in shaping the organisation. How are you going to tell them what they need to do? And again, around senior leadership, ultimately, you are responsible for your own organisation. If you are the registered manager, you are the person in law that is accountable to CQC. So it is important that you understand how you can shape that organisation and get everybody on board. And again, how are you going to evaluate that? How are you going to work with people? How are you going to manage supervision? And how will you manage quality improvement? So looking then at the essay structure for this, you're going to have to evaluate internal governance, explain your own roles in applying and leading and evaluating governance. You've got an example essay there with your conclusion as well. And then I think that's the end of that one, because 2B.1, answers to requirements of inspection. Let me just check. I think we're going on to a new module. I think that's next week. Let's just have a look. Resources. Oh, it's sticking today, isn't it? There we go. Yeah, so next week then, we're going to look at regulatory processes for adult care. And then we're going to look at that single inspection framework, which I'm sure a lot of you by now will have looked at and started to get your head around. As I said, if you are part of the United Care Network, you will then have access to our quality assurance tools. And some of these tools, I just want to show you. Now, this isn't all of them, but it's some of them. We'll just bring this around here and we'll open that up. Now, I tend to have a tendency here of carrying on talking and then people are like, Steve, we can't see your screen. So I'm going to go back to here. Screen one, open. Okay, so on here, let's just have a look, for example, recruitment and retention toolkit. So here we've got 7 tips for better recruiting and how to improve your employees there. And then here, these are the toolkits in which we've got. So we've got interview questions, interview records, interviews examples, checklists, policies and procedures, recruitment checklists, shortlisting templates, recruitment validation, and robust recruitment consideration checklists. So again, these tools have been designed to meet the single inspection framework. And if you follow these, then technically you're showing good internal governance. And again, here you can see there, look, whoever does the audit, robust recruitment consideration, have you produced an accurate job description? Have you got a specification? Is your information about education requirements clear and understandable? So you can go through that, tick it off, and if you've done it all, then you're following good, robust recruitment processes. And the idea there is you can go through all of that. And, you know, if we bring up the checklist there, there's your checklist. So if you're following all of that, you should be fine on your single inspection framework audits. So, you know, from the hours of offer to have you had your references, have they been verified? Have you got appropriate DBS? Have you received this? So again, You may want to add to that. There may be more that you want to add. But that's just the starting point, right? So you should have a range of tools and documents that support what you do. But equally, you will have your policies and procedures. So again, following your policies and procedures, you can see there, we just talk about the Equality Act. We look at different regulations there, the procedure. So it tells you about the job description, the job specification, how you advertise, the application form and the packages, what you're looking for, how you shortlist, how you interview, how you make your selection, your health report, your criminal record, your references, your entitlement to work, your contract, and your exit interview. So it manages that staff process from end to end. And what you need to be doing is looking at your policies and procedures and going, does that cover everything? So for example, in here, I couldn't see things around the minimum core skill around English, maths and ICT in line with best practice. So again, you might want another one of those that says best practice, and you could put skills for care recommendations in there. But anyway, you get the point. You get the point. So each job or each section of what you do, you will have your tools, and your tools will have policies and procedures. If we look at medication, there we go. Look, huge amounts for medication, checklists, improvement plans, reviews, observations, practice, monitoring, training. And I get asked this one a lot. What's the observations of practice? There you go. There's an observation of practice. So it's just an audit. It's just an audit. So lots of tools there for people to go through. And again, you can pick the ones that you want. You don't have to use them all, but they are there. And if you haven't got them, then you need to be questioning yourself, what can I do? How will I know that my staff are? Again, you've got your medication policy here. So you've got a basic policy here. What I like about these, they're all linked to the NICE guidelines. So you can follow your medication policy, and then you need to make sure that staff are trained in line with your medication policy. Grand. Well, like I said, it gives you an idea. The other thing that we talked about was compliance. I don't know why I hit that diamond button. Around compliance, we look at the ISO standards. And the ISO standards are 19,001, 18,001 and 14,001. Again, you have to pay for these, as in going the full accreditation. You can do a process which is called self-certification. And self-certification looks at you following the principles of a framework without actually having to pay for it. Because again, I appreciate money is quite tight. And it's obvious my computer doesn't want to share that with you. So you can Google ISO 9001. If you are a member of the United Care Network, you can go straight to our quality page. There is a page all about ISO standards. You can have a read of those 3 standards. There are sample manuals on there. So just to give you an idea, 19,001 2015 is quality. Basically, it runs through how to produce a document, which sounds relatively simple, but it's about making sure that it's gone through robust processes, that documents have document control, and that proper governance has taken place. The manual has an audit tool in it and a non-conformance report, so you can follow that through and check what you need to do to tighten up there. So that's 9001.2015. We then got ISO 14,001 and 18,001. I can't remember the numbers after it, but one's a health and safety compliance tool. Again, health and safety manual, lots of things for you to consider. And then there's the environmental one as well. So again, if you're new to quality assurance, if you're new to compliance, using national frameworks are really helpful. And actually, as you progress up through your leadership chain, if you can start getting your head around them now, by the time you become a senior leader, it's all we talk about ISOs. So it's worthwhile jumping on that. Anyway, I hope you found that session useful. I look forward to seeing you next week in session 6, when we're looking at 2.A1. And yeah, have a great week. So take care, and I will see you all next week. Bye for now.